Have you ever noticed your belly still looks a bit rounded even months after giving birth? Or perhaps you feel a weakness in your core? These experiences are common for many new parents, and understanding what is happening with your abdominal muscles is a wonderful first step towards regaining your strength and confidence. The way to check for abdominal muscle separation, also known as diastasis recti, is through a simple self-palpation technique. This allows you to feel for a gap between the two main bands of your rectus abdominis muscles, which run down the front of your abdomen. Diastasis recti occurs when the connective tissue that joins your outermost abdominal muscles, called the linea alba, stretches and thins during pregnancy. This stretching can create a visible or palpable gap between the muscles. Understanding the extent of this separation is crucial because it helps you know what types of exercises and movements are safest and most effective for your postpartum recovery. To perform this self-check, begin by lying on your back with your knees bent and your feet flat on the floor. Place one hand behind your head for support. Now, take the fingers of your other hand, palm down, and position them just above your belly button, pointing towards your pelvis. Exhale gently, then slowly lift your head and shoulders a few inches off the floor, as if you are starting a small crunch. As you lift, use your fingers to feel for the firm edges of your abdominal muscles contracting around them. Make a mental note of how many finger widths fit into any soft space or gap you find between these muscles. It is helpful to repeat this process just below your belly button and also a few inches higher, above your belly button, to get a full picture of the separation along the midline. Knowing the measurement in finger widths provides valuable information. A separation of 2 finger widths or more is generally considered an indicator of diastasis recti, and understanding this measurement can guide your specific postpartum exercise plan. It is not just about the width of the gap, but also about the depth and the tension of the connective tissue you feel. A deeper, softer separation often suggests a greater need for targeted core work and professional guidance. Performing this simple self-check gives you important insights into your postpartum core health, enabling you to make informed decisions about your recovery journey. By identifying any abdominal muscle separation, you can then focus on appropriate exercises and movements that truly support the healing of your core, paving the way for stronger, more functional movement in your daily life.